Hello everyone, I'm Anas Al-Ubaidi, and the topic or the title for this session is Roles and Primary Responsibilities of a Medical Scribe within Chapter 34, which is about review of medical scribing within Certified Medical Administrative Assistant Course Program by ACMSO. Introduction. Medical scribes are integral members of modern healthcare teams, acting as the communication bridge between physicians or clinicians, patients, and administrative systems. With healthcare increasingly reliant on detailed documentation and electronic health records or electronic medical records, EHR or EMR, scribes play a crucial role in ensuring accurate real time charting during patient interactions. By alleviating physicians or clinicians or providers of the burden of clerical and documentation tasks, scribes enable them to focus on what matters most, which is the patient care. The importance of medical scribes goes beyond efficiency. Properly managed patient records are the backbone of continuity in healthcare. They provide a clear narrative of the patient's conditions, facilitating effective communication across specialties and healthcare settings. This ensures better clinical outcomes, improves patient satisfaction, and enhances workflow in high pressure environments like emergency departments or outpatient clinics. For students pursuing advanced medical scribe training, understanding the roles and responsibilities of a scribe is foundational. A scribe's tasks extend from real-time documentation to managing complex administrative duties while upholding accuracy and compliance with healthcare regulations, such as HIPAA in USA, or anything similar in another country. Mastering these responsibilities requires not just technical proficiency but also strong organizational and interpersonal skills, means certain skills, to meet the demands of a fast-paced clinical environment. The objectives here we have understand the purpose and value of medical scribes in a healthcare setting, identify the core responsibilities of medical scribes and their impact on care delivery, learn the key skills and qualifications necessary for medical scribing, recognize the common challenges faced by scribes and strategies to overcome them, apply this knowledge to practical clinical contexts to enhance healthcare operations. Key points. Core responsibilities of a medical scribe. Medical scribes have multifaceted roles that primarily center around assisting physicians or clinicians with documentation, managing patient records, and providing administrative support. These responsibilities are critical to reducing the workload on physicians or providers or clinicians and maintaining efficient clinical workflows. Documentation. Scribes are the primary custodians of real-time medical documentation during patient encounters. Their attention to detail ensures that patient records are comprehensive, accurate, and up to date. We have real-time charting. We have medical records or health records management. The benefit here provides physicians or providers or clinicians with precise data to refer to during follow-up visits and ensures legal and compliance standards for documentation are met. Clerical support. After documentation, we have clinical support. In addition to documentation, we have clinical support. Now, administrative tasks managed by scribes save time for providers or clinicians and improve operational efficiency. Administrative tasks, we have communication. The benefit here reduces delays in administrative processes, enhancing the patient's overall experience. And here is a diagram on administrative support by scribes. Skills and qualifications. To perform their duties effectively, medical scribes must possess a combination of technical expertise and interpersonal skills. Part of the skills and qualifications include technical skills. Scribes must be proficient in handling healthcare technologies and tools to document accurately and efficiently. Electronic health record or electronic medical record proficiency, typing speed and accuracy. And in typing speed and accuracy, the ability to type rapidly 60 plus words per minute while ensuring all entries are error-free. Example, keeping up with the physician's rapid-paced instructions during a busy clinic shift. And the benefit here for the technical skills ensures that documentation requirements are met in real time, minimizing transcription errors. Skills and qualifications, interpersonal skills include also interpersonal skills. Medical scribes often serve as an intermediary among team members and patients, requiring excellent communication and organizational abilities. Communication here, scribes must interact clearly and professionally with physicians, nurses, and other healthcare team members. Example, clarifying a physician's dictation to ensure accuracy in the documentation of medical findings. Attention to detail ensures completeness and precision when managing medical records to avoid errors in documentation or patient care. Example, double checking allergy information before submitting updated patient files. Benefit here for interpersonal skills builds trust with the healthcare team and ensures smooth documentation processes in fast paced settings. And here is a diagram on key skills for medical scribes. Challenges faced by medical scribes. Despite their vital roles, medical scribes encounter several challenges, demanding organizational acumen and problem solving skills. Accuracy. High standards for documentation accuracy must be maintained to avoid clinical errors. The problem misentered patient histories or medication lists can result in adverse care decisions. Solution use structured workflows and frequent cross checking to minimize errors. Conduct regular data audits for quality assurance. Time management, balancing real time documentation with additional clinical duties can be overwhelming. The problem here, in addition to accuracy, time management, problem here managing physician or provider dictation alongside preparing referral letters may lead to missed details or delays. Solution, develop an organizational system and prioritize tasks based on clinical urgency. Workflow dynamics. So time management, accuracy, and then workflow dynamics, working in high pressure environments like emergency rooms, tests, efficiency and adaptability. Problem, unpredictable workflows such as simultaneous admissions may overwhelm scribes during peak hours. Solution, remain flexible with prioritization techniques and anticipate workflow patterns for better preparedness. Examples of clinical application, documenting complex cases, scenario a patient presents with multiple complaints requiring detailed charting for coordination among specialists. Scribe role here, the scribe ensures all documentation is updated, including imaging results, lab data, and referral notes for each specialist involved. Streamlining emergency departments. Scenario, a busy emergency department ED with constant patient turnover requires timely charting to support physicians or providers or clinicians during rapid consultations. Scribe role, the scribe documents vitals, symptoms, and physician recommendations in real time, ensuring efficient patient flow. Summary tables, table on core responsibilities of a medical scribe. Here we have a table on skills and qualifications, table on challenges in medical scribing, table on examples of clinical applications, table on strategies for effective scribing, and then next we will revise what we have covered via this lecture through some MCQs or multiple choice questions. Question 1. What is one of the core responsibilities of a medical scribe? A. Prescribing medicine. B. Real-time charting during patient visits. C. Diagnosing patient illnesses. Or D. Designing healthcare equipment. The answer definitely is B. As medical scribes, focus on documenting interactions in the electronic health record EHR during patient visits. Question 2. Which technical skill is essential for medical scribes? A. Cooking. B. EHR proficiency. C. Artistic drawing, or D. Carpentry. EHR proficiency. B. As medical scribes must efficiently use electronic charting systems like Epic or Cerner or Kerner. Question 3. Why is time management important for medical scribes? A. To improve hospital facility operations. B. To balance documentation tasks with clerical duties. C. To increase patient interaction time. Or D. To delay follow-up actions. The answer is B. To balance documentation tasks with clerical duties, as scribes must manage multiple responsibilities like documenting visits and handling clerical tasks without compromising efficiency. Question 4. What is a major challenge faced by medical scribes? A. Conducting patient surveys. B. Maintaining accuracy in documentation. C. Performing lab tests. Or D. Leading medical workshops. And the answer is B. Maintaining accuracy in documentation, as accuracy in documenting patient information is critical for medical scribes. Question 5. Which of the following best describes the clerical support provided by medical scribes? A. Organizing referral letters and managing prescriptions. B. Conducting legal consultations for patients. C. Teaching medical education courses. Or D. Designing EHR software systems or EMR software systems. So the answer is A. As clerical duties, such as managing paperwork and e-prescriptions, are part of a scribe's responsibilities. And here we come to end of this lecture. Thank you very much and goodbye.